Hiya, I'm Teoh, obstetrician and gynecologist and fertility specialist in Perth. Now this video may sound like a promotional video, but I'm actually excited in putting together a pregnancy care which is comprehensive for my patients. I work with different allied healthcare team in fertility, in gynecology and in pregnancy, and I know how important it is. That's why I want my patients to have the best experience with the help from different health professionals and different resources that we have so that we can have the best experience and best quality care. I've shown you about the package in the past. You can get information from my website anyhow. Here we go. It's a bit reflected. It's called PreciousMums Pregnancy Care. Now it is all inclusive. Yes, I did say all inclusive, i.e. You get those extra sessions with no extra charge, i.e. I ask those allied healthcare team to charge me, and I bought a few things for my patients. Now what do you get from it? Number one, you get a copy of my book, which I've shown you in the past. It is actually quite hard to write a book like that. In the past, I've written, doctorate thesis, chapters and different things, but to write a consumer book is a different way of approach. So quite a bit of effort before I managed to publish it. You can get information on pregnancy care, lifestyle, different topics relating to pregnancy health and fertility health, of course, in this book. What else do you get? You get a phone app for pregnancy yoga. It's called Yogi Birth. Inside there they have yoga classes, meditations, antenatal, postnatal instructions and classes. It's run by a midwife, and I find it very good. That's why I bought them in bulk and give it to my patients. You have one session of personalized dietetic service from an accredited dietitian. You get this quite early in the pregnancy, so my patients from very early on can have a personalized dietary advice, which is important for the health of mums and babies. You also get one session with a pregnancy physiotherapist, I think physiotherapist is so important in all pregnancies. All my patients have certain things relating to pelvic bone, pelvic floor exercise, back, carpal tunnel, different things that we can make use of the services from our physiotherapist colleague. I got one new stuff. It's very new. This is the first time I'm showing it for you. I think I've given this to one or two patients. It's really new. If you can see, I'm trying to get the reflection again. It says Bodhi J. Not sure how many of you know much about Bodhi J. Let me pull the ribbon. Ta-da-ta-da. Let's see what's inside. Again, Bodhi J. It's a spa actually. Bodhi J got a branch in Westin Hotel, the new 5-star hotel. They also got 5 different branches in WA, including one in Margaret River. So what am I giving you? So this is a voucher for I'm trying to synchronize with on camera. It's a pregnancy massage essentially. So why pregnancy massage? Research has shown that pregnancy massage actually is good for pregnant women. It's not only safe, it is good for the joint, it's good for mental well-being. Now I might have mentioned in the past many of my patients, because of their past obstetric history or because of miscarriages in the past, of a long fertility journey, they might have taken many years before getting pregnancy up to this stage. So I had to spend extra time and effort in making sure my patients, not only looking after them well from the very early stage, but also to make them feel reassured. And sometimes they just want to chat, want me to check over a few things, which I'm very happy to do. I'm happy to sort in patients, see patients after hours or after my clinics, to have that extra reassurance and checking. Now, all those comprehensive care, they're important, they're good for mental and physical well-being, but it doesn't replace the 24/7 specialist care, which most of the time I manage to see my patients myself. If not, my specialist colleague will cover, rarely, but they are there. And also the other thing, it doesn't replace the importance of the continuous care. So only a few of my colleagues and I, we can, or we are willing to, or we are allowed to look after patients in King Edward privately. So for example, in Subiaco, we can look after babies from 30 weeks, which is pretty good. Mount Lawley from 34 weeks. Sometimes some babies trying to, due to various reasons, as we know, trying to try to come to this world a bit earlier, or sometimes earlier in pregnancy. We have some patients have to be hospitalized for close monitoring or checkups, and it has to be done in King Eddie's at some stage, maybe. So yeah, I put in the extra effort in making sure that they see me privately in King Eddie's, rather than have to be transferred to various other groups, and which give that extra reassurance. And I have promised, I think, look, with the COVID, many of my patients got hit financially. I promised to do bulk billing in the early stage of pregnancy. No matter how many times I see them, up to 23 weeks, I bulk bill. I think this carries on until end of November, which I'll keep my promise. I'm still bulk billing my patients for the early stage of the pregnancy until end of November. All right, this is it. So yeah, precious mums, all pregnancies are precious, and we should give our best care. See ya, bye.